Welcome back to Mummy Matters. Our guest today is an incredible mother of two who's a birth worker specializing in hypnobirthing. In our episode, she shows us how empowering mindset can be, especially during pregnancy and while delivery. The founder of Mystrimumma is Pooja Mystry.
Thanks so much for having me, Raki. So I'm Pooja. I'm the founder of Mystrimumma. And a little bit about me is I'm a mum of two. So I have a 3-year-old, Sham, and I have a 1-year-old, Veer. And like my background was perinatal mental health. And I come from a family where kind of like there was a lot of struggle with pregnancies. There was lots of kind of the unknowns about labor and birth. And I think that kind of being brought up in that environment about not knowing what's going on with your body, but equally feeling like everything's kind of taken over by medical professionals and clinicalized and things. I didn't know what to expect when I became pregnant. I think before I even thought about becoming carrying a baby, actually, I was more so worried about how long it would take me to become pregnant. And I was fortunate that I got caught like straight away, which I know that it is a struggle for so many people. That I think it really hit me because I was so worried that it would take me like 6 to 12 months to become pregnant. When I did, it suddenly hit me like, right now I am pregnant. How am I going to get this baby out? Because all those kind of, emotions about birth and labor kind of start flooding in, and everyone around you in their experiences kind of hit you. And obviously my experience with perinatal health, a lot of mums kind of that I supported postnatally came through with kind of postnatal depression or some sort of postnatal illness as a result of birth trauma. And actually 1 in 5 mums actually deal with that, which is a huge number. Like, that's the known number. So I don't know how many mums that aren't even accepting or telling people about this, but that's 20% of mums that are experiencing birth trauma. So when I was pregnant with Sham, I really wanted to know what I could do to kind of make sure that I would decrease that chance for myself as well. And I found it at 35 weeks, which is quite late on. But I decided to do a crash course in it, and it was amazing. Like, to cut a long story short, I've labored at home with him for 10 hours. And then I remember Hemant, my husband, he was kind of watching an entire game of New Zealand versus India, a full-on cricket game, while I was just like labouring away with each of my surges and kind of managing myself. But he was timing them. So, he was doing something, but he watched an entire game of cricket. And I remember my waters going, and my hind waters went right my forewaters. And he was on the phone with my mum having a full-on discussion about what to have for lunch that day. Like, my mum was like, oh, shall I make lamb pie? Shall I make shack? And we're like, I remember saying, oh, well, we need to go now. My waters is broken. He was like, I can't see any waters anywhere. And I was like, no, it's just the hind waters, but we really need to go. Like, I think I'm ready. And, he was really supportive. We went in. And I think that going into hospital, although was my plan, upon kind of reflection, I thought actually maybe it wasn't the best thing for me. I went in, and the midwife initially was trying to do a vaginal examination, and it was actually irritating me, and I felt like she was getting very much in my way. And she went on to then tell me that I was only 3 centimeters dilated and that I had to go home. Yet my body was telling me something completely different. She even went on, bless her, to tell me that I wouldn't be giving birth for at least 3 days at this point as well, which I don't think any labouring woman needs to hear, like, that you're just going to continue being in this zone for however many days it's not something that somebody wants to hear. But my husband was able to advocate, and he said, can you just leave us in the birth pool, leave us alone for a bit, and then we'll call you when we need you. And she goes, oh, I'm going off for my lunch, and if you need anyone, just press the buzzer, but I don't think this baby's going to come. And lo and behold, in 10 minutes his head was out. And I remember shouting to my husband in transition something, and he was like, right, she's really ready to kind of give birth. And another midwife walked in, and she was like, let me get a mirror and have a look. I was like, nope, you really don't need to. There's something round and furry between my legs that's not usually there. Definitely a head. And I think that, listening to my body at that point and going with what I thought was right. And then my husband being my backup as well, was really helpful. I think that if we both didn't listen to ourselves and we blindly just followed the lead of the professional, I could have easily birthed my son in my dad's car on the drive back home. And I'm not sure whether my dad would have been too happy about that. But like, I think it's so important as women to listen to our intuition. For a lot of things, like even in your parenting journey, just generally life itself as well, where we listen to ourselves so much and we know what our gut's telling us. Yet when it comes to labor and birth, we kind of almost give that control away. And I think it's so important to kind of rein it back in. But again, you know, knowing that we work together as a team, that really helped. And that kind of was reinforced with our second birth with Veer. I think Hemant the first time said, "Oh, I felt like it was a bit of a fluke." And then after second with Veer, so Veer's labour was a complete hour, 3 hours and 40 minutes from like the start to him being born.
Yeah.
And when my husband compared the two, he was like, okay, yeah, hypnobirthing's not a fluke. Like there is real science to it, and I can understand the difference. And again, he was more clued up with the second time, and we opted for a home birth. But with this as well, I didn't tell anyone that I was having home birth because, you know, the stigma behind having that home birth and everyone going, well, what if things go wrong, or you're too brave to do this, and you know, something happens to you or something happens to baby. And I think there's again this misconception about what a home birth is or what kind of support you can get with a home birth. And I think it's really important to educate yourself about your options before you make a call. And just like I said with my first, like I labored at home for 10 hours and I was doing fine. And it was only until the midwife told me that I was only 3 centimeters in the hospital and that I wouldn't be giving birth that I started to panic. And at home it was fine, it was great. And I remember being fully dilated, but not quite ready to birth my second. And the midwife was like, "Oh, you're fully dilated, let's get pushing." But because they had a midwife swap over at that time, she didn't get a chance to read my birth plan. So she wasn't aware that I was a hypnobirthing teacher and practicing hypnobirthing. But again, Hemant was able to step in going, "Don't tell her to push, she'll breathe and she'll do it when she's ready to do so." And again, you know, knowing that he was there and taking my side and being able to support me was so important. And again, like, I remember birthing Veer and just turning around, holding him, feeling so elevated and proud that I just achieved this most miraculous thing of like birthing my child in my environment. And just being able to say, you know, I've just done this. And I remember turning around going, I want to do this all over again. In fact, I tell it to quite a few people that after I birthed him, I wanted to do it again. People look at me like I'm weird, like, you want to go through labor and birth all again. And actually, I think that, you know, if it's done right, if you are well supported, and you feel respected by your professionals around you, and I think that's a big key element of it, right? Like, I'm not saying that we go into battle with professionals, but it's equally about being respected as a birthing person. Like, you are the most important person in that room when you're giving life, you are birthing. And, you know, regardless of whether it's a vaginal birth, cesarean, you know, it doesn't matter what route it's going down, you are the most important person in that room. So your wishes should be respected. And you should feel like you're in control and that you have a choice at all points as well. So I think for me, knowing that I can give that support to other women, I don't empower them, I just help them to realize they have that self-empowerment and they just have to bring it to surface and they can experience the same thing. Because, you know, giving life and birth, I think, is like the most important thing that a person or a woman can do. Like, I don't think anything beats it. If somebody had to ask me, would you have a positive birth or an amazing wedding, I would definitely say a positive birth. Like, you will remember that every year, like every year for their birthdays.
Yeah.
It's not just their birthday, like I should be celebrated because I birthed them that day. So yeah, it's like a memory that will stay with you forever. So I think naturally it should be something positive, right?
Yeah, no, definitely. I mean, even with myself, it's quite funny because with my first, I went in early because I had like a bleed, and it was like a period bleed, no pain or anything, but I had that, and we went to the hospital. They said, come in, we'll get you checked out, and they were like, oh, you've got issues with your uterus, and so, like, proper scared me.
Yeah.
And then started the process off for me, and then literally baby was here like 6 hours later. But then with my two girls, like literally it was record time. It was literally like 4 hours start to finish, and I did most of it at home. I just made it both times to the hospital,
Yeah.
one push, and they were both out, and that's what it was like. And I think it is this thing that with every pregnancy, I don't know about you, but with every pregnancy, you just seem to be more calmer. You just seem to kind of know
Yeah.
what's coming. And I honestly feel it's because of the fact that I was so calm, that my labor was so quick, or it was just easier.
Yeah.
I mean, with all three, to be honest, it wasn't a hard labor or anything, so I'm quite blessed like that. But it is, I do find that the mental state of the mother matters so much. And I think it is, like you said, it depends on who's around you as well. If you've got someone stressing that, you've got to go, I think that affects you more than the fact that you're actually giving birth. So yeah.
Exactly, because we can pick up other people's emotions. We do that on a day-to-day basis. Think, that saying of I can cut the tension in the room.
Yeah.
Like it can happen. It doesn't even have to be a birthing environment. You walk into a room and you will be able to pick up the general sense of how people are feeling in that room without anyone actually verbally being able to tell you. Yet when you are birthing, you are in a vulnerable state, so your senses are heightened, and you are going to be picking up things. And if there is something that just doesn't feeling right, and you're already a bit panicky, or you're trying to manage each surge that's happening with your body and trying to help and work with your body, but something's just intervening, or someone's saying things, or someone's doing things, and it just is affecting your birthing scenario in a negative way, like naturally it's gonna put you in a downward spiral, unless either your birth partner knows how to break that cycle for you, or you're knowing how to do the breathing techniques, or you're knowing what's going on. And just like you said, sometimes like they don't tell you exactly what they're doing and why they're doing things. And that is quite scary. Like, this is your body, and on a day-to-day basis, you wouldn't let average person walk past you and just hold your hand, would you? You wouldn't let a stranger do that. So in a very intimate environment of labor and birth, why are we feeling like it's okay for medical professionals to just touch your intimate areas or be invasive and look at things without giving you a full explanation of what they're doing and why they're doing these things? Because if anybody was to touch me, my first response would be to go into adrenaline, you freeze, you fight or flight. Naturally the same response would be if somebody touches your intimate areas, and it's a vulnerable time for a woman. So I think it's an important time to then also be respected, to be given your choices, explained about the processes and why these are. And sometimes that's not the only option, and they don't always tell you your options. So yeah, it's really important about your birth partner knowing how they can then step in and go, I understand this is what you're saying, but are there any other options? Can we explore anything else? How long have we got before we've got to make these decisions? Because again, sometimes I think you feel like you've got to make that decision on that spot. I think, at 40 weeks, like, induction is on the cards, isn't it? Like, they drop it on you at your 40-week appointment with your midwife. So the next steps are, in accordance to our hospital policy, that we're going to be looking at an induction date for you. Don't explain the process of induction. They probably give you a leaflet, but I think we could all read the same leaflet and we could all interpret it in different ways, right? So they just give you basics, and you don't know that you can say no. I think not very many women think.
I didn't know until I read your content. I didn't know. I thought it was just a given that when you hit 40 weeks, that's it, you're gonna have to get this done, and that's it.
Exactly. It's like baby inside should know that they've got an eviction date, and clearly they don't. Like, they have no idea that somebody on the outside or a computer somewhere has decided their due date, and and if they're not coming out, then they're going to be forced out. Like, if you just think about like years and years and years ago, and I mean, when we were cave people, or hey, even take it back to our own heritage in India and stuff, like, yes, there was a rough idea about when it would happen, but it would just happen.
Yeah.
And women would support women, like, you know, and this is so funny because like my grandma in India, when she found out that I did have a home birth, she was like, oh wow, you were really brave to have a home birth. And I turned around to her and was like, so how did you give birth to mom and mamas? And she was like, at home. I was like,
what's the difference?
what have I done differently to you? And it's really sad again that her perception of it has massively changed, even though her experience of birthing 4 children at home was near enough equivalent to what I had with my second one. Yet she thought so many different things because of what society presents, what people say, people scare you and things. And I think nowadays I hear that actually, you know, cesareans are more on the cards in India at the moment as well, which is really, really sad. But like, you know, when we do look back, it is a very female orientated event. It is an event, right? Like there's the birthing woman, but equally she's supported by everyone around her. Like there is obviously a midwife equivalent, but there is somebody that's supporting with that. There's nobody, however, kind of forcing that baby out. They're all there around the mom to help build her up for this event of birth, not right, you know, this is what the day that we predicted it would come and it's not come, so let's start forcing baby out. Because induction, it can be more intense because there's fake hormones that are being pumped into your body, and your body's not always ready for that. And when your body's not ready for it, it'll fight it because it has no idea what's going on. So, you know, I think it's really important to be informed about those different journeys, and then to ask questions in order for you to find out whether it is the right choice for you or not, and then to decline it or accept it depending on what you feel is right for you. And I think that's where there's a huge gap at the moment as well, Raki. Like people just don't understand that they can question professionals, and it's not to question their authority or to question their expertise, but it's to question the process to see if the process is right for you. I think that's the difference. I'm not kind of saying that we question somebody's intelligence. It's just the process. Because at the end of the day, we've lived with our body from the day we were conceived, basically. We've grown it, we've grown up. So suddenly in this very intimate time, why is it that we're now trusting a textbook that is not specifically made for our individual bodies? It is an average, and we don't all fit averages. Like, yeah.
You touched on the fact that you used hypnobirthing for your own labor. Do you want to go into that? I mean, what is hypnobirthing for those who don't know? You know, what's involved? What's the process?
So the biggest part of hypnobirthing is mindset, you know, like we discussed a little bit earlier. Really about understanding the process of it, of the process of labor, about the process of birth, and changing how we view it. When we change our perception about what labor and birth is, based on true facts, true births, and knowing what's actually happening inside our bodies. Because I think what we usually hear when we hear about labor and birth is very much like, oh, it was painful. Like usually this is something that I ask in my class to all my clients. And I shout out words and things. And the top 3 things that kind of come up are pain, screaming, and woman on a bed with professionals around her. Like they are like the top 3 things that continuously come up. And when our perception of birth is that it is of pain, it is of scream, it is about being surrounded by professionals, actually what we're doing is we've never experienced that, but we're believing that information to be true because either people have told you that or TV has told you that. And actually there's so many things that I've seen on TV And I now sit down every time I see a birth scene on TV, on any program or anything, I shout at the TV going, that is not a real perception of it. My husband's like, no one can hear you. Just like relax, no one can hear you. But it's sad, right? Because when we're not shown anything different and we're constantly being fed the same information, we're accepting it to be real. So when we're becoming pregnant and we're approaching our estimated date, all of that resurfaces and it feels like that is going to happen to us. So we started to tense our body up. We start to get fearful about what's to happen, even though we've not experienced the sensation of labor or of a contraction, of a surge. We're just anticipating that it's going to be super painful, like to start off with. We've not even done it and we're thinking it's going to be really, really painful. So our body is going to respond to it being painful, right? And our brain is great at keeping us alive. However, it doesn't know the difference between real and perceived threat. So the information that we've kind of accepted and then believed to be true, that labor is painful, labor is about screaming, labor is about professionals taking over, well, you're believing that. So your body is going to respond to that information, which means that every time your body does contract and baby is trying to make their way down, you're closing yourself off thinking it's going to be painful, yet your uterus doesn't know that, your baby doesn't know that, and they want to just get along with the process. But because your brain is telling your body, no, you're in danger, you're in threat, actually that's affecting your cervix dilation. So when that's affecting your dilation, baby can't go or work their way down your birthing canal, which means that they're almost fighting with the dilation, and that increases your pain. So what that ends up being is a very negative cycle of fear, tension, and pain. And it becomes a self-fulfilling prophecy. So, you're anticipating it to be painful. Your body responds to it by trying to protect you. Your baby doesn't understand and your uterus doesn't understand what's to carry on. So it does become painful. So the idea behind hypnobirthing is when you understand the process, when you're able to surrender to each surge, and, I don't ever teach my women or my couples that I can take pain away, because pain is very subjective. Like you could get a paper cut, Raki, and I could get a paper cut, and we could both respond to it in different ways because our threshold of pain is very different. However, with hypnobirthing, using the tools of mindset, using the breathing techniques, being able to keep yourself calm and relaxed, and actually processing your brain to understand that this is a natural process and it needs to happen. Like labor has started, this baby is coming out. We have to work with it. If we work against it, then it's just going to make the process longer and more difficult. Whereas if we're able to work with it, breathe with it, your partner knows how to build up the right hormones to help you in the process. Actually, you can shorten your labor down time like drastically, because you're not fighting the surge. So those surges, each time you're contracting, the muscles are moving up, baby is moving down, and your body, your baby, and the process of birth is all working together. And basically the easiest way for me to describe it is that if a woman was in coma and she was ready to birth her baby, it would just get on and do it. And it's as simple as that. Like, it wouldn't need any medical intervention. I don't think, people wouldn't know, because she wouldn't be screaming because she's in coma. People wouldn't recognize that. But your uterus knows what it's doing. Your baby knows what it's doing. What gets in the way is our mindset, because our mindset and our brains have constantly been fueled with negative things. And until we're ready to make that change, and I think that's one of the biggest things is that, people ask me, is hypnobirthing for everyone? And yes, it is. It is 100% for everyone and every different type of birth. But equally, I don't have a magic wand. No hypnobirthing teacher has a magic wand. So in order for it to work, you've got to come in with that open mindset, with that willingness to understand how the body works, how the mind affects the body, and implement the tools. Like, I set homework each week, and if you don't listen to the relaxations, if you don't use the techniques and the tools that I'm telling you, you can't just end up going into labor and birth on the day going, I've done the course, now it's just going to happen. Well, no, because I'm teaching you the tools, and it's again, you know, that whole teamwork effort, but equally knowing your birth rights. I think, you know, which I think is so important, that women know that they have birth rights and that they can question things and they have choices. And I think it really helps to balance the expectation and the reality of labour and birth. Because equally, I know so many women's birth plans that consist of, I want a water birth with no medication, yet they have no education behind it. They've not learnt tools. They've not done the research.
Yeah.
They don't have plan B, C, D. So it, you know, and no one's plan goes to plan A. Like my plans didn't go to plan A. My second one, I didn't realize that I progressed so quickly, and the midwives didn't recognize how fast I was going. That they came home and saw that I was dying. I was surging, but my face didn't match it because I was so relaxed and calm. They were like, "Oh, okay, yeah, she actually is moving quite quickly. We need to go back and get the pool." But by that time they went back to the hospital, got the pool, and started setting it up, there was no way that I would get from upstairs to downstairs. Like, you know, my surgeries were coming so fast that I ended up birthing my son in our bedroom, which was definitely not in my plan A,
Yeah.
nor in plan B at all. Like I thought I'd be birthing downstairs, but it didn't happen. So it's about understanding the different routes that you've got, and being open-minded to different journeys. So if you're planning for A, B, C, D, you're still remaining in control. And equally, like, I did have an induction plan when I wrote my birth plan. You know, when I wrote it down with my husband, I said, you know, these are the things that I'm happy with. These are the things I wouldn't mind discussing if absolutely required. And these are things I definitely don't want. I also spoke about cesareans as well, because I thought, you know, I don't know what could happen. You know, he could release meconium. Anything could happen in that day. I could become thoroughly exhausted, or something could happen to me where there could be a clinical indication for a cesarean to save my life and baby's life. And I need to plan for that. So we had that plan back as a backup. Yes, they were plan X, Y, Z, but I think it's so important to have that, and that's something that I also discuss in my classes as well. And it's so important part of hypnobirthing is you are planning for different birthing journeys in order to remain in control. So I think, you know, when I try and sum it up, hypnobirthing is about remaining calm, feeling confident, and remaining in control of your birth.
It's amazing. And I know it's like you touched on the kind of stuff that you see on TV and, you know, those around you. And the funny thing is you always tend to hear all like the negative side of it. Like people will always tell you, oh, I was in labor for this long, but no one will say to you, oh, I've had a really good birth. Do you know what I mean? Like you just don't hear that. You don't hear, oh, it was a quick birth. It was just, oh, you only hear that, oh, this took this long and this happened like this and I was in so much pain. And it's this thing that you just build yourself up mentally and you don't even realize you're doing it. I think a lot of the time you've got it there at the back of your head, and it does, like you said, resurface. So it affects you massively. Like even with myself, it's quite funny. Like with my third, when I saw my show, I was just like, right, okay, I've got a bit of a backache. I haven't really got any tummy pain, nothing, no other pain. It's just a little bit of a dull backache. But then I put it down to I was really nesting with my third, so I literally took my whole kitchen out and I was organizing all my drawers. So I thought it might just be that I've lifted too much or something like that. Lower back pain. I was like, let me go for a shower. So I went for a nice long shower. I did all of this, and bearing in mind, like, you know, I was probably going through the contraction but didn't feel any of it. My husband came in, he had his dinner, you know, he sat down for 5 minutes, and I was like, right, I think I need to go now. This is coming like regularly now, like quite a lot. And literally we just made it to the hospital, and it's one of these things, like even now I'm thinking, oh my gosh, like, you know, this baby could have come at any point. Like and so, and bearing in mind I've got the other two at home as well. I'm just like, this could have been hard work, but luckily it wasn't. But people don't tell you stuff like that. People don't tell you.
No. And I think it's sad that people aren't talking about the positive things, right? And I've experienced it myself. I think that having worked in the birth world for quite a while, I'm able to kind of get rid of the negativity pretty easy, but it's not easy for every woman, and I understand that. Like, the responses that I get for both of my births is, oh, you were lucky to have experienced that. And although I do believe in luck, like, I don't think the majority of it was based on luck. I did a lot of hard work. You know, I did lots of planning, I did lots of education. I looked into my options. And I had a birth partner that was on board with me. And obviously, naturally, I don't think hypnobirthing itself does the course justice. I don't think it does. Like, everyone comes in going, oh, hypnobirthing, does this mean you're going to put me under a spell? Or they're really skeptical, especially birth partners, they're really skeptical about it. But I think when you put the science behind like how it works, and how mind affects your body, you know, mind matters, they're able to put it into context a little bit better and understand what it's doing. And I think that makes a huge difference when you're both on board and understanding things. But yeah, like, people still say it. So my first son, he was born at £8 too. Now, just to put it in context, like, I'm 5'1" and I weigh less than 50 kgs. I'm really petite. And no one was expecting like an £8 baby. But I remember when he was born, everyone was like, wow, that's big for an Indian baby. And I was like, yeah, I know. And I was shocked initially, but you know, when they always say, oh, there's going to be a big baby, you're going to tear, you're going to do this, you're going to do that, and they really scare you with things like that. Well, no one guessed him to be £8 too, and I didn't tear. I used the breathing techniques, I worked with it, and I was fine and he was fine. But equally, second time around, oh, your first baby was this big and your second baby is going to be bigger. The second one was £7.9. And again, like, you know, I think people like to just throw information at you from hearsay as well. And I think that it's sad. And I know this as like somebody that's worked with like mind and psychology for a while now as well. But we're drawn to negative things. We're drawn to drama as human beings. Like, if things go well, we question it. And if things don't go well, then we're just like, oh, it's meant to be. And I think that's a really bad thing. Like, why aren't we accepting good things can happen? Or why aren't we being inspired by these positive things and going, well, if she can have it, why can't I do it? Like, why aren't we doing that? Or, you know, we always look at somebody's negative and go, oh, if that happened to her, that's just going to happen to me. Why can't we translate that for the positive? If that's happened for her, I want to have the same. What can I do to have that same experience? Or like I did, I witnessed and heard about lots of negative births. I was like, well, I don't want that to be me. So what can I do to change that? And I think we really need to kind of change that around for women in our community, and even men as well. Like, I've already started to implement things with my 3-year-old. You know, he knows what hypnobirthing is. In my plan A, he was supposed to be home and actually be in the birth pool to help catch his baby brother. And when I tell that to some people, people are like, are you sure you wanted a 2-year-old in the same room as you? And I was like, yeah, because it's fine for him to see what happens. Like, I'm not doing anything wrong. I'm doing a really natural process. I'm bringing his baby brother into the world, and it's not for everyone. I appreciate that. But for me, as a birth educator, I felt like I need to normalize birth. We need to educate the next generation to not be scared, to know their rights, to be able to be supportive. And hopefully I'm bringing up 2 very good birth partners for the future. But, you know, even now, like, he asks me about how babies come out, and I showed him a cesarean birth that I use in my classes as well, again, to normalize it. You know, this is what can happen and this is what a lady does. And he's 3, and people are like, oh, are you sure that's appropriate? And it's a normal process. Like, you know, you take him to a wedding, you explain what's going on. Like, it's a normal thing that we all do. I don't show him vaginal births because I think that that's inappropriate for him, because I don't think he's at the age to understand that. But if he has a general interest in what I do as part of my work and wants to know how babies are being born, well, I can show him a route. And I think it takes away that curiosity as well, before he's even gone into school. And I think that's a big thing as well. I don't know if you've noticed, because obviously, Raki, you've got older children. But when I look back at school and sex education, it's all about not becoming pregnant. And there's nothing about birth education. So what do you do if you become pregnant? And how do you manage that?
So true.
Like, I don't know if you ever watched it. I remember being like 9 or something and watching like the first thing on TV. And I think I vividly remember my school room, and being shown this woman with her legs up on stirrups, screaming her head off, birthing this baby. And it's weird. Like, I'm now 31, and this was like when I was 9, and it's still ingrained in my head. And when now as a birth educator, I'm like, well, why was I shown that when that's not a realistic picture of birth?
Yeah.
And that's what we're setting our future generation up for. Why are we doing that? Why are we not educating them in a more positive light?
But yeah, it's so true. Like, I don't understand why they don't. Maybe they probably think it's not age appropriate or whatever. But like you're saying, it's all about education, isn't it? The more educated people are, the more of an accurate and realistic approach they can take to things, and they'll know what their options are. They'll be able to seek support when it's needed. And I think that's a big thing that we need to start kind of doing with, especially this generation, so that the next generation have it already like in them, and to not be so scared of seeking help, to not be so scared of like talking and opening dialogue about things that we'd not necessarily talk about. So I mean, in your opinion, why do you think, or what stigma do you think is attached when it comes to birthing and labor and birthing partners? And
people are gonna hate me out. But it's a man's world. And I'm not against men or anything like that. I'm married to one. I have 2 boys that will grow up to be men. But I'm reading this really interesting book about the passage into like motherhood and childbirth and things. And it's so sad that there have been so many men's influences about childbirth, and kind of always been that like dominant person that's kind of making those choices and decisions. Like, even when you look back, women really weren't into big careers or professions for a very, very long time. So decisions about women's bodies were somehow being made by male professionals. And I think that that's kind of unfair. Like, if you aren't experiencing a woman or a woman's body, or not knowing what's going on with it, how can you make these decisions about it? And actually, I think that over time, women have slowly lost their voice as well. Like, we aren't supporting each other as women and being a unit, and we're kind of allowing the white coat to take over, and we're not kind of working with each other. We're not giving that community of a whole. And I get it. I think nowadays our lives are just so busy, right? Like, we've got so much to do. Generally, I think just life is just go, go, go. It's just really quick and fast paced. That before, we at least had that community, and there was that generation of talking to the next generation, and I think that stopped somewhere. And I think that's what the issue is that there's that stop of communication, where you were giving that almost education from your mum, and being supported in it. But equally, I think somewhere in some cultures as well, it's just a taboo subject. Like, I don't want to hear about it. I don't want to talk about it. It's a very quiet thing, or it just needs to happen in closed doors or things. And it's not surface. It's not just, it's slowly not spoken about because people just don't think it's important. And I think that's really sad. Like, it's a very important thing to be spoken about. Like, just like I said with like my grandma and my mom, and my grandma clearly didn't speak to mum about it. And unfortunately, mum came here when she was like 20 or something, got married and had me when she was like 27. She had some infertility and stuff. Uh, and she didn't realize like she could ask for things. And equally, because she was not with her mom in this country. And I think, when you're talking like 1980s, 1920s, getting that communication of even like a phone call to back home in India was hard enough in itself, that she didn't get that support or her community with her guiding her through it or talking to her about it, that she didn't have it. So she naturally felt the next best person could be the white coat. Like, you know what you're doing, you're educated in it. And I think now, when she looks back, she's like, when I teach her about hypnobirthing, oh, Pooja, I didn't know this. Or, oh, I thought I just had to have the epidural because they told me that I wasn't coping, so I needed it. Or I was told to push. She keeps telling me that she was told to push when she wasn't feeling ready for it. And then, she looks back at it and she's like, but it's fine, you're here and you're healthy. And I'm like, yeah, but mom, I know I'm here and I'm healthy, but you're still looking at bringing me into the world as a negative experience. Like, I'm here, I'm good that you've got your child, especially after, struggling with conceiving and things. But the experience of birth for you still remains very negative. And when you look back, even 31 years down the line, you're not seeing it as a positive experience. You're very much scared about what's happened. And I think that transpired when I told her about, especially about my home birth as well, because nobody's spoken to her about it. She was going off her own experience, and communicating that to me, which I think was good, but based on not real things. When I told my mum and dad, it was really weird, and this is not what I was expecting whatsoever, but when I told both my parents I was having a home birth for Veer, my dad was like, oh yeah, this is amazing, let's go for this, you're going to be fab. And my mum was like, are you sure, Pooja? And I wasn't expecting that. You'd usually expect like your mom to be quite nurturing and like on board with it. But equally, I think when I look back at her experience, I think all that was flooding back. And she was almost putting me in her position and going, what if this happens to my daughter? And actually, she's protective of her daughter. So she's going to want to do what she thinks is best. And I think she came to the house after Veer was born, because they brought Sham back home. And it was only like about an hour after I'd given birth, and she was like, you look amazing. Like, you did the best thing. And she's like, I'm sorry I ever doubted you. And I was like, it's fine, mom. Like, I'm good with it. But this is what we need to start showing other people, right? We need to start showing the world and more women that it is normal. We can work together as a community, and you can always have that support and be reassured that things are going well. And they might not go in one direction because birth isn't linear, but regardless of which ways and which turns they might take, you can still be in control of that situation.
Yeah, I love that. So with birthing, is there any myths? There probably is loads, right? But is there any myths that you can kind of shine a light on?
With birth itself, or like hypnobirthing?
Hypnobirthing, with birth, with labor, any of that section that you're an expert in. What other myths that you have heard, and kind of, can you let us know, like, is there any truth in them?
Yeah, there's some myths, definitely. So people feel like it's going to be super painful. I think that's the biggest one. I think everyone has this myth about it's going to be really, really painful. But, just like I explained before, like, if you're working with your body, it doesn't have to be as painful as what you're making it out to be. Naturally, when you're going to birth your baby, as in when the head is almost earthside and you're about to birth, yes, that's going to be increased because naturally the pressure down in the bottom of your pelvis and, you know, as baby's coming out, that is going to increase, yes. But the start of labor is not, it's not painful. And if you're already started to have that perception to start off with right at the start, well, it's just going to increase with each one really, but it's not as painful. Another one is that, and I think this is like a massive one, is that I don't, or hypnobirthing teachers don't work with professionals, or we're very much like, don't do what they say. And that is a complete myth. So I'm fortunate to know quite a few midwives in the community in Leicester. So the home birth team in Leicester, obviously they came to my birth, but equally a lot of my clients have had home births, or, you know, they didn't realize that they wanted a home birth. They did the course and they opted in for one. But the home birth team know me really, really well. And they work so well with like my clients, and even other hypnobirthing teachers that I know, when they're kind of teaching their clients as well. One of the biggest things is being able to work with your professional, because obviously if you're walking in like you're wanting an argument, your professional is not going to be on your side because they're going to be feeling undervalued. So naturally they'll feel more protective of themselves as their role of a midwife or as their role of an obstetrician or whatever their role is, right? They're going to be more protective of it. Whereas if you're walking in with tools that appreciate their years of experience, the time that they've taken to educate themselves about it, but equally go in with your own research to say, you know, I've researched about my body and I've researched about this subject and how I feel this affects my body. What you're saying doesn't quite feel right for me. Can we open this up as a discussion? How does that work? And yeah, that turns it completely different. In fact, I had a mum this year, and she was absolutely amazing. That she came to me initially saying that she had a elective cesarean just booked in. Like there wasn't a discussion about it. She was just given a date for an elective cesarean based on the fact that she was a geriatric pregnancy, which I would describe her as, but she was an older mum. She had high BMI, and that she had gestational diabetes. So she ticked boxes, but that was it. Like there wasn't anything in particular that the professionals had told her about her body that was not able to carry her baby. There wasn't a risk for her. There wasn't a risk for her baby. She was just gone, oh, you ticked 3 boxes. We're going to book you in for an elective. She went on and obviously like she only did the first session and went back and spoke to like an anaesthetist, which she had an appointment with. Went back with some research. And actually, I like to point out that this anaesthetist was a male. And she said to him, look, I feel like I don't think a cesarean is right for me. I've got all these things and I feel like none of these impact my body. There's nothing at the moment that's shown that baby's growth or weight or anything like that is being affected. I'm fine and well in myself. So I would like to have a vaginal birth. And her male anaesthetist sat there going, it's amazing and so refreshing to see that I've seen a couple walk in here as a team, know their rights, have done their research and ask for what they think is right for them. And he was like, yeah, I think you're right. I think a vaginal birth is absolutely doable for you guys. I think that is it, right? Like they went in, they didn't go all guns blazing about this is what we want, this is what you're going to do. It's this is what you've presented us. We've taken that away, researched it according to my body, and we don't feel like it's right for us. And this is why we feel like a vaginal birth is right for us. So we weighed up our pros and cons and now presenting this back as a discussion so that we can come to an agreement together. So I think, you know, when everyone thinks that we're very much against like hypnobirthing teachers one side and professionals on the other, well, it's definitely not like that. It's about educating our clients and our families to be able to work collaboratively with the professionals, because we want you to be holistically supported. You know, we want you to be held in lots of different ways so that the outcome of birth is as close to what you want.
Yeah.
So that's one of the biggest myths as well. And I think another one which surprises a lot of people is that it can be used for cesarean births.
Oh wow, I didn't know.
So yeah, so I do a specific one for cesarean births. And lots of people don't know that. They just think, oh well, oh I've got placenta previa, for example. So my placenta is basically blocking my cervix and I'm not going to have vaginal birth because it's blocking it, so I'm going to have a cesarean. I don't even need to look at it. Well, actually, the tools that we teach in hypnobirthing are definitely applicable to cesarean. In fact, the breathing techniques I still use now with my 3-year-old and my 1-year-old when I'm feeling really overwhelmed. I'm just like, give me 5. I need to practice this breathing technique so I can calm down, come back to you and address the situation better. So it is a lifelong skill. But yes, it can be used in cesareans because, you know, we're not only looking at the birth aspect itself, but again, the journey of birth. So what kind of elements would you want to incorporate to have as close to that journey of a vaginal birth? You know, would you like to see your baby being born, for example? Like a lot of people don't even realize that they can watch their baby being born. You know, some women are very much like, that's squeamish, I don't want to see that, I don't want to see the blood, that's not for me, no thank you. But actually, if that's something that you envisioned when you didn't realize that cesareans was on the card, but you wanted to see your baby being born and suddenly thought because you're having a cesarean you can't have that, you know, that's an element of birth that's taken away from you. So the idea is that you're shown different aspects. Again, like, you know, as we were speaking about being calm in labor and birth, well, if you're calmer and your body's more relaxed when you're having a cesarean as well, your muscles are relaxed, which means that as the incisions are being made through each layer to get to your baby, those muscles won't have to fight the incision as such because they aren't tight and tensed. They're much more relaxed, which impacts your recovery, you know, because they're not fighting to not be torn. Actually, they're like, okay, well, this incision needs to happen in order for baby to come earthside. I'm going to have to work with it. So when you're suctioned up, actually the recovery works better because your muscles are so relaxed. So, you know, even though you may have the spinal and you're not feeling anything, actually the impact of what information you're processing in your brain to tell your body and how your body is responding to that affects the process, the operation, and also like impacts your recovery as well. So I think it's really important for women to know that actually it's not just for vaginal birth, it's not for a specific type of birth, is completely applicable for different types of birth, because the idea is that you are calm, you are in control, you know, you are confident dependent on what situation has come up. And so I think they're my top 3 myths that people like. It's not professionals, or it's really painful, or it's definitely, you know, it's only for a particular type of birth, when it's definitely not.
That's amazing. So in terms of like going forward, do you think that like we're on the road to progress? Because obviously things weren't spoken about before. I mean, you speak to a lot of parents. Do you find that you're still having to almost come against that mentality, that way of thinking, or do you think that's shifting now?
I think it's slow progress. So hypnobirthing has been around for a long time. In fact, I think it's been around since the 1980s, but clearly nobody kind of knew as much about it.
I didn't know about it until I met you, I'll be honest. I did not know about hypnobirthing. So yeah, it just shows, doesn't it, that there's a lot of work that needs to be done.
Yeah.
Yeah.
And it's actually, so if you think about it, if it's been around since the 1980s and we're now in the 2020s, like, I don't think we're just touching. Like, I think we've still got a long way to go. And again, I think it's because external factors aren't something that we can control. Like, we can control what goes on for us, but you know, birth is still very much viewed as clinical and medical, and we've got to change that. Again, the information that's being shared by things that we're seeing on a day-to-day basis, like on TV and things like that, that needs to be changed. You know, if you're constantly feeding the same thing, and I think, you know, when I think about it, the only scene that comes into my head is from Friends when Rachel is there and screaming her head off. But you know, I grew up watching Friends and stuff, so that is something that sits put. But equally, I have seen it on lots of films and sitcoms and stuff, and I think that needs to change drastically as well. Like, and I also think we look up to like celebrities and things, and we need to really reel it down to average Jane.
Yeah.
You know, I think some celebrities are understanding, and have kind of, there's a few that have spoken about the fact that they have practiced hypnobirthing. I think obviously like Kate Middleton's spoken about it and things, but it's not norm as yet. Like, people are still skeptical about the idea, and I just like to put it out that you won't know whether it works or doesn't work unless you try it. And why are you willing to risk it when you could potentially have a positive experience? Like, why are you so skeptical about it not working and not doing it, where if you gave it a go, practiced it, that could give you an alternative outcome? I think that's the difference, you know, that lots of people. So I think we've got a long way to go. We've still got a long way to go. And I think maybe, and I don't know whether this is wishful thinking, but maybe the generation after our children might have some hope. But again, that's just I think it's wishful thinking. I still think there's lots of people that are not on board, or a lot of people are very much still, I don't like to use the word worship, but maybe they're more succumbed, or they're more fearful of the white coat, or, you know, we can't go against hospital policies and things. And people don't realize that hospital policies aren't law binding. You're breaking the law by saying, no, I don't want to do what you're saying, consultant, doctor, or whatever. You're just asking for what's right for you. We just need to learn to love ourselves and trust ourselves more. And that's, I think, that's generally hard, I think, isn't it? Like, when you talk about mental health as well, Raki, we don't do that enough. We always look to be validated by others. Yeah. And actually what we need to learn to do is to validate ourselves. Because if you don't validate yourself, and you don't trust yourself, and you don't love yourself, how can you expect other people to do it? Right? So you need to respect yourself, respect your body, in order for you to have that confidence, so that other people do that with you as well.
That's so true. Well, on that note, I think we'll bring this podcast to a close. But it was lovely having a chat with you. And it was lovely.
Thank you so much for having me.
Going through all the different topics that we have kind of touched on, and delve deeper into, you know, kind of the ins and outs of it. But hopefully people will look into hypnobirthing more. But if people want to get in touch, where's the best place?
You've got my Instagram as Mystrimumma, or you can always go onto the website, which is mystrimumma.co.uk. There, or you can give me a call, and that's on my website.
Perfect. Thank you so much for coming on the podcast. I really appreciate it.
Thanks so much, Raki.